Hello and welcome to another episode of Health Options. I am Rabi, Abdallah. Not getting pregnant, despite having carefully timed unprotected sex for 1 year, could be a source of concern to any couple. The cause of infertility may be difficult to determine, but may include inadequate levels of certain hormones in both men and women and trouble with ovulation in women. The Nigerian situation is put at more than 100,000 cases per year. Many treatments which significantly improve the chances of getting pregnant varies. We shall bring you these treatment options and other information that could go a long way in not only helping couples to make informed choices, but change their perception as well as broaden their knowledge on the issue of infertility. Our complementary segment takes a look at cholera, which is on the rise with attendant high death toll. The NCDC says it's much higher than deaths from COVID-19 at the moment. Thanks for joining us on the program. If you're just joining us, this is Health Options, the program that not only tracks government policies on health, but helps you with the right information you need to make informed choices about your health. Our attention is on infertility and treatment options. And to take us through the topic is a renowned consultant obstetrician and gynecologist, Dr. Bami Boye Ezekiel Ogumbi. He's a pioneer medical graduate of the Ahmadu Bello University Zaria and a former member of Council of Society of Obstetrics and Gynecologists of Nigeria, SAGAN, with almost 50 years in active medical practice in both public and private space. Thanks for joining us on Health Options, Doctor. Yeah, it's a pleasure having you with us.
It's a privilege to be here.
And we were privileged to share in your wealth of experience in the medical field.
The pleasure is mine.
Okay.
Thank you very much.
Yeah, we're looking at infertility.
Yeah.
Infertility is, if you ask me, not a friendly word.
No.
Won't be a friendly word in any home.
No.
Okay. So, when should we start looking at a situation of infertility in a couple?
Thank you very much. Generally speaking, when a couple live together, majority will not conceive within the first 6 to 8 months of togetherness. And even when all is well on both sides. And so basically, we gynecologists, we are not worried because we know that that is a normal phenomenon. Because it's also possible that they may not meet at the right time, or because of work situations, they may not have circumstances that will make them meet. And so when we start to think that there's a need to look into what is going on is when they have been living together and they've been having active, unprotected family relationship for a period of 1 year. So from then on, then we can say, yes, maybe they will need some counseling, and maybe they also need simple explanation about the physiology of their body, and so that we really do not raise fears in them that something serious is going on. And when they come to us, we have to see both the husband and the wife, not seeing one at the exclusion of the other. The problem can actually arise from either the woman or the man, or in some cases, even both. And so we see them together as a couple. And we are not looking for who is at fault. We are looking at what factor is at fault. Because generally speaking, when a situation like this arises, then the blame game comes into it. Oh, it's your fault, it's my fault.
And suspicion.
And suspicion and the rest of them. The assumption is the female is the one at fault. And whereas this is completely false.
What would you say remains the major cause of infertility in both men and women now?
It varies from person to person. But by far the commonest is challenges relating to ovulation. And in our own environment, we can also rule out factors relating to the fallopian tubes, either partially blocked or completely blocked. But having said that, when you have young male and female married, less than 25 years of age, their reproductive potential is excellent. And unless some challenges to their health has occurred in the past, they usually have an easy time investigating and thereafter correcting whatever the challenge is. Basically, we have to let them know that for them to get pregnant, there must be ovulation. For ovulation to take place, the sperm must be made available to be able to reach the ovum that is shedded from the ovary once in the middle of the cycle every month. And so with all these, sometimes we find out that simple counseling will, in majority of cases, give them a leadway as to what to do to achieve conception. However, there are some situations in which a woman would have had a previous history of either pelvic infection, which may have blocked their fallopian tubes, or sometimes they may have had abortions, termination of pregnancies, when they have unplanned pregnancies that ended up with pelvic infection and somehow has affected either the endometrium or indeed the fallopian tubes, which is the duct through which the egg passes before there's an opportunity for the sperm to make the egg and before fertilization takes place. And by and large, you also have some that have situations from hormonal factors. And so basically, after we have counseled them, we have examined both of them, we examine the man and make sure we also ask, has he had challenges at one time or the other with some diseases that can actually affect this production of sperms in him? We want to know, did he have mumps as a little child? This could affect his chances of fertility. And has he had injury to the testicle, like a torsion of the testicle, or even one thing or the other that may affect the production of semen or sperms? So after we are taking all this history, and in the absence of all this, we do it by exclusion, and then we know where to go from there.
The quality of sperm matters here.
Oh, definitely.
So what could, tinker with that in a man to make it not having the needed quality?
A man who is hooked on alcohol can have poor quality of sperm. And some of them also who are hooked on marijuana, smoking, cigarette, marijuana, all these affect the quality of sperm. And indeed, the man also may have had some sexually transmitted disease at one time or the other that can also affect the duct along which the sperm after production comes out. Up to more than 20% in cases of infertility is responsible through the men, not only women, as it is being wrongly conceived.
What are some of those, aspects of solution that the couple need to, explore and take advantage of before going to what many could say should be seen? I'm sure experts like you will want to seen rather as the last resort, talking about IVF now.
Before IVF came, we used to do tuber surgery. And there are particular tuber surgeries that do not need elaborate things, that if it is one affecting the tube and it is in the femoral end, that in an expert hand can actually lead to success. And apart from that, the majority of them are purely due to ovulatory challenges. And when it is ovulatory challenges, all we need to do their hormonal profile, know exactly what is wrong. In some cases, there is a particular hormone called prolactin. If prolactin level, which is being produced from the anterior pituitary, is at a high level, even that alone can create the challenge that we are talking about.
That's on the part of the woman.
On the part of the woman. Yes. And this can be corrected simple by medical treatment with drugs. They also have situations that are called pelvic endometriosis. That is when you have the endometrial tissue. It is outside the normal environment, which is supposed to be within the inner lining of the womb, is outside. That is a situation which, again, if it is not in severe cases, can be simply treated with medication. Fibroids is by far the commonest benign conditions in the female between the age of 25 and 40. If you take about 100 women, in fact, if you go to the marketplace and you look about 5 women between the age of 25 and 40, almost 1 or 2 of them will have fibroids. The symptoms they have also will suggest that they need some medical attention. And sometimes once this is corrected, and if it is the only circumstance, then there will be success at the end of it. Now, there is a condition that we call polycystic ovary syndrome. This also is a condition where the hormones of the female is producing more male hormones, and therefore is negating the procedure of fertility. And so this is a difficult one to treat, but most often they respond to drug treatment. If there's a high prolactin and it is the exclusive one, we give drugs that will correct that. If there is challenge with the hormonal situations, either you have too much thyroid hormones or too little, we know what to do.
Can we touch on the issue of IVF, the benefits, the risks?
Yeah, I must say that IVF, is in vitro fertilization, has changed the narratives for management of infertility, especially for a very small percentage of the women and the families that are looking for babies. As it were, the egg and the sperm is brought out in the laboratory and transferred into the woman's womb when you find out there are circumstances that have prevented her from conceiving all over the year. And it is very, very expensive. So not many people can afford it. But having said that, the results of those of our very, very brilliant gynecologists who are doing it is comparable to almost any in the outside world. And I'm glad to say that we have quite a number of members of our society all over Nigeria.
They're Sogon,
who are actually helping women in so many, many ways to do that. But of course, who are we now talking about? The people who can afford. And the other problem with that is that you do not have any guarantee that the first attempt will do the trick. And so it may be repeated. And I've known of some families who have sold their houses, sold their property, only to go into this, and some end up successful, and others not so successful. And after that, of course, there could be a lot of emotional challenges.
What have you got to say, to young ladies, young couple who wouldn't want to go through the conventional way of, conception?
You know that every aspect of human endeavor now, everybody's in a hurry.
Yes.
They are in a hurry to get rich. They are in a hurry to do everything they want to do. So it's not surprising that some will say, look, I would rather go and do IVF ab initio, even before going to anything else. And for God's sake, what are we talking about? I mean, this is not right because, one, first of all, it has benefits, but it also has disadvantages. There are so many other reasons some people want to do it. Some will say they will sex selection. Some will say, oh, they want to have also even some genetic disorders like sickle cell disease. These are noble causes, and one will say, yes, go ahead. But when you go purely for aesthetic reasons, or because you are in a hurry, or because you have so much money to spare, I would rather say, please be careful, because it can backfire.
Okay, what will be your final word to viewers there where infertility is concerned? Patience, making the right choices, and all of that.
I want to say that procreation is part of life, and definitely every woman and every man or every family, God has a good plan for you. The first thing you must do is make the right choice. Approach the problem in a progressive manner, and don't be in a hurry. And you'll be surprised that you'll get the answer somewhere along the way. However, we must also say that IVF has come to give broader options to some people who otherwise will never have children. So for such, there is provision. And so you can access that type of care, and so that you can have a happy family.
Thank you so much, Dr. Gumbi,
Thank you so
for
much,
spending your time with us on
Thank you so much.
We really appreciate you.
Thank you very much.
Reports from the NCDC indicate that cholera is spreading at an alarming rate and claiming lives in the country, much more than COVID-19 at the moment. Our next segment takes a look at the predisposing factors to cholera and prevention.
Cholera outbreak in Nigeria is not new. In fact, in the last 5 years, we've had cholera outbreaks several times. And in 2018, we had over 40,000 cases in 20 states, in 2018 alone, and very close to 1,000 deaths in 2018. Now, in the last 2 months, we've had cholera outbreak in about 22 to 23 states in Nigeria. Why do we have cholera outbreak? First and foremost, we need to look at, what is the access to safe water sources in Nigeria? About 30% of the population lack access to safe water. That's why. We also have 46 million people, which is about 23% of the population, practicing open defecation. What does that mean? They go outside in the open to pass excreta. And where does this excreta go? It still goes back to the environment. Now, cholera is just an offshoot of contamination of food we eat, now contaminated with fecal matter. It's as simple as that. So it's a fecal-oral problem. When feces inadvertently is ingested into the body, it brings about cholera. It's as simple as that. So what do we need to do? Now, I know that a lot of people have been talking about cholera. It's a big issue in Nigeria. Yes, I agree. I totally agree. It's a big problem. And I'm also, I'm interested to know that Nigeria happens to be the second most cholera endemic country in Africa after Democratic Republic of Congo. So it's not a new problem to us. Just like malaria. Yes, you are right. So it's not a new problem. So, and we also know what the causes are. The causes are people do not have access to safe water to drink. People do not have access to effective sanitation. People still practice open defecation. And let me also tell you, hand washing alone, it's a very important practice to prevent cholera. But in Nigeria, more than 100 million people, about 56% of the population, do not even have access to facilities for proper hand washing. So how do we expect to prevent cholera? That's the question. Now, it's not just about providing water. So you can have big water schemes. If you do not have effective sanitation facilities, it's still going to be a problem. Even if you have access to sanitation facilities, people do not have the behavior, they do not adopt the behavior of proper hand washing your hand properly under running water with soap. And for people in rural communities, they can use ash. If you don't do all those things, you still have problem of cholera. We need to have community-led approaches to preventing cholera. First and foremost, even when we have water, save water, it might be safe at the source. We need to look at the water chain. As we are fetching the water from the source, as we are transporting to the household, as we are storing for use in the household, we need to ensure that all the containers are clean. That's what they call safe water chain. That's very important. We also need to adopt the habit of hand washing at critical times. When we use the toilet, we come out of the toilet, we need to wash our hands properly. Nursing mothers who are taking care of children need to wash their hands properly all the time. Because as they touch food also, as they prepare food for babies, they prepare food for the family, we need to wash our hands. So proper hand washing is very important. And one of the things that UNICEF is also doing, UNICEF is supporting the federal government of Nigeria to develop what they call hand hygiene roadmap. And hand hygiene is all about proper hand washing. How do we keep our hands clean? As you see our fingers, when you look at them, they don't look dirty. But I can assure you, everything we touch has its own dirt. And these are small things that really lead to cholera. Now, if somebody is infected and the person defecates in the open and there is no rainfall, the rainwater will just flush everything straight into the water source. All the people who drink from that source will have cholera. It's as simple as that. So we need to ensure that our toilets are not close to the water source. And even if at all, the toilet has to be downhill while the water source is uphill. So it won't allow the sheet underground to climb into the water source. There are simple measures, but they are very important. While we also continue to encourage the government to ensure that Nigerians have increased access to safe water. I know there are quite a number of water schemes, and that's why UNICEF is also supporting government to not just to build new water schemes, but to rehabilitate the existing water schemes. We need to rehabilitate them. We need to ensure that they are working. We also need to do campaigns, hygiene promotion campaigns. It's very important. As I said, the role of the media, the print media, electronic, and even social media, very, very important. So we need to continue to do that. And I also think sincerely that chlorination is very important. The existing water sources will need to be chlorinated. UNICEF is also supporting in some of the states to do that. And we've just secured some funding from UK Aid, and I see that as the Swedish International Development Agency, to support some of these, about six of the states that are badly affected, to ensure that they have ORS, that's oral radiation salts, and then zinc tablet for people who are affected, and to also ensure that there's chlorination of the existing water sources, and do hygiene promotion campaigns. We are really working on that. We are working with the federal government and also the states concerned as UNICEF.
And that's the size of our package for this week. A quick reminder that you can go to our YouTube channel to watch the upload of this and other episodes of the program. Email us for your comments and contributions at healthoptions@nta.gov.ng. Remember also to stay safe from cholera and COVID-19 by observing the safety protocols as well as personal, food, and environmental hygiene. I remain yours, Rabi Abdallah. Many thanks for watching. Hope to see you again.